Welcome to New Hampshire's Business. I'm Fred Coker. Health coverage is important to all of us, isn't it? Well, so why was there a shortage in the enrollment for a very affordable health care program in New Hampshire? Let me show you the numbers and you know what it is. It's the Affordable Care Act. The latest Affordable Care Act numbers, at least in November 2017 and 2018, you can see there's about a 3,000 person difference, just about, who are residents that signed up or re-enrolled. Now here's some numbers for the U.S., the same thing. November 2017 as opposed to 18, and there's a difference there of thousands. It's down. Now, one of the reasons is the Center for Medicare and Medicaid Services cut 90% of funds for enrollment, publicity, and outreach, and they cut 80% of the consumer assistance funds. That would hurt. And there could be other reasons too, but I'm going to talk to my guests about this because it's important to New Hampshire. They are Xandra Rice Hawkins, Executive Director of the Granite State Progress Education Fund. Welcome, nice to have you.
Thank you for having me.
And Lucy Hodder, Director of the Institute for Health Policy and Practice at the UNH Law School, and also Professor of Law. Welcome.
Thank you.
Were you surprised at the shortage of enrollment for this program, which is actually now affordable, more so than it used to be?
You know, we were not surprised, but we really are hopeful and encouraged that people will listen to the fact that coverage is open till December 15th.
Right.
We were not surprised because of the confusion and misinformation that's been circling around access to coverage. But the ACA is still in effect. Coverage is available.
Even with the changes that have been made in Washington, it's still affordable and it still does what it was envisioned?
Absolutely. Affordable is anyone's question and judgment, yeah. But the intent of the Affordable Care Act was to make sure insurance coverage, health insurance coverage, was robust and available to everybody, and it still is. We have one of the lowest rates of people without insurance in New Hampshire. People signed up in droves. Yeah. Most people have coverage.
Yeah. Xandra, you're the advocacy group for this act in New Hampshire, and you have good news, and that is that some of that shortage has now been made up.
Yeah, I mean, Granite Staters across New Hampshire are recognizing the need to have health insurance, and as we near the deadline, as we've tended to see in each enrollment period, we see more people starting to sign up, and we're really hopeful in this last week here that we'll have enough people to kind of get us back to the level we were at before.
Was the shortage really a result of the cutback in the publicity and the outreach by the Center for Medicaid and Medicare Services in Washington, or was there something else?
We believe it's because of the publicity cuts, and in fact New Hampshire doesn't have any dedicated navigators this year as a result of some of those funding cuts. But this year as well as last year, private foundations like the New Hampshire Charitable Foundation and the New Hampshire Children's Health Foundation have teamed up Granite State Progress Education Fund and our partners, the New Hampshire Healthcare Coalition, to run the Covering New Hampshire effort, which is an opportunity to advertise local enrollment fairs, do digital ads and social media content and grassroots efforts to make sure people know how and when to enroll.
Lucy, the coverage, actually the services that people can expect right now with ACA, have they changed or are they the same?
They are the same. So you can sign up for coverage if you're an individual through the marketplace, otherwise with a group plan, or through the new Granite Advantage plan, so Medicaid expansion, and you get essential health benefits. So your mental health and substance use and your essential health benefits are covered as part of that plan.
And there are 3 insurers involved in the ACA in New Hampshire. Who are they, Xandra?
They're Ambetter,
Ambetter,
Harvard Pilgrim Healthcare, and Anthem.
And Anthem. And there are about 15 plans, I understand. Is that right?
Yes, there absolutely are.
So you've got a real choice.
You have a choice, and there's a lot of information that you can access through Covering New Hampshire on cost, what benefits you get, your deductible, et cetera. And most people get support. Most of the people who sign up get some government support.
Now here's how to enroll. Let's put that graphic up. And here is how you can enroll. There it is. Okay. Online at healthcare.gov, or you can call this 800 number, 318-2596, or through an insurance broker. Those are the ways, and you've got till only December 15th to do this. So if you want to enroll, go do it. Thanks a lot to Xandra Rice Hawkins, Executive Director of the Granite State Progress Education Fund, and to Lucy Hodder, Director of the Institute for Health Policy and Practice at the UNH Law School. Thanks a lot.
Thank you.